There is something you are doing every single night before bed that is causing your blood pressure to spike dangerously while you sleep. And you have absolutely no idea it is happening. You go to bed thinking your body is about to rest. You close your eyes. You drift off. But inside your chest, your heart is pounding harder than it should be. Your arteries are under pressure. They should not be under. Your blood vessels are constricting when they should be relaxing. And by the time your alarm goes off in the morning, hours of silent cardiovascular damage have already been done. Night after night after night. I have seen this pattern in hundreds of patients over the years. They come to me frustrated and confused. They say, "Doctor, I do not understand. I eat well. I exercise 3 or 4 times a week. I take my medication exactly as prescribed. But my blood pressure will not come down. My numbers are still too high." And when I ask them one simple question about their evening routine, the answer is almost always the same. And that one answer explains everything. It explains why their medication is not working as well as it should. It explains why their morning readings are always elevated. It explains why they feel exhausted even after 8 hours in bed. Today I'm going to reveal the number one bedtime mistake that is spiking your blood pressure overnight. And more importantly, I'm going to show you exactly how to fix it starting tonight. Not next week. Not next month. Tonight. The mistake is eating a heavy meal within 2 to 3 hours of going to bed. I know it sounds too simple to be dangerous. I know it sounds like something that could not possibly have a major impact on your cardiovascular health. But let me walk you through the science behind why this one habit is silently wrecking your heart and your blood vessels every single night. And once you understand the mechanisms, you will never look at your evening meal the same way again. When you eat a large meal, your body has to perform an enormous amount of metabolic and mechanical work to digest that food. Your stomach churns, your intestines contract, digestive enzymes pour into your gut, blood flow gets massively redirected away from your extremities, away from your brain, away from your muscles, and toward your stomach and intestines. Your heart has to pump significantly harder to maintain adequate circulation to the rest of your body, while simultaneously supplying a huge volume of blood to your digestive system. Your metabolic rate increases substantially. Your core body temperature rises. Your insulin levels spike as your pancreas works to process the incoming sugars and carbohydrates. And your sympathetic nervous system, your fight or flight system, becomes markedly more active to manage all of this metabolic activity. Now, here is the critical part that ties this directly to your blood pressure. When you go to sleep, your body is supposed to enter what we call a parasympathetic dominant state. This is your rest and restore mode. Your heart rate is supposed to slow down. Your breathing is supposed to deepen and become more regular. Your muscles are supposed to fully relax. And your blood pressure is supposed to drop significantly. In fact, there is a well-documented and extensively studied phenomenon called nocturnal dipping, where a healthy person's blood pressure naturally decreases by 10 to 20% during sleep compared to their daytime readings. This nighttime dip is not optional. It is not a nice bonus. It is absolutely essential for cardiovascular health. It gives your heart a period of reduced workload. It allows your arterial walls to relax and recover from the stresses of the day. It reduces the strain on your kidneys. It allows damaged blood vessel linings to repair themselves. This nightly recovery window is one of the most important things that happens in your body every 24 hours. But when you eat a heavy meal right before bed, you completely and thoroughly sabotage this entire process. Instead of entering that restful parasympathetic state, your body stays locked in an elevated metabolic and sympathetic state. Your digestive system is working overtime. Your heart keeps pumping hard to supply blood to your gut. Your insulin levels stay elevated. Your body temperature stays raised. Your sympathetic nervous system stays activated. And that critical nocturnal dip in blood pressure that is supposed to happen simply does not happen. You become what cardiologists call a non-dipper. Your blood pressure stays elevated all night long, sometimes even higher than your daytime readings. And being a non-dipper is extremely dangerous. This is not a theoretical concern. This is one of the strongest predictors of cardiovascular catastrophe that exists in medicine. Research published in the most respected cardiology journals in the world has consistently shown that people who do not experience this normal nighttime drop in blood pressure have a dramatically higher risk of heart attack, stroke, heart failure, chronic kidney disease, retinal damage, cognitive decline, and death from any cardiovascular cause. The numbers are staggering. Non-dippers have roughly double the cardiovascular risk of people who dip normally. Your heart needs that nightly break. It needs those 6 to 8 hours of reduced workload. Without it, you are essentially running your cardiovascular system at full throttle, 24 hours a day, 7 days a week, 365 days a year, with no rest period whatsoever. And over time, no matter how strong your heart is, it breaks down under that relentless pressure. But the damage from late-night eating goes even deeper than just preventing the nocturnal dip. Let me explain what happens to your blood chemistry, your hormones, and your organs when you eat a large meal, and then lie down to sleep. First, let us talk about insulin and the sodium connection. When you eat, especially foods high in refined carbohydrates, sugar, white bread, pasta, rice, or desserts, your blood sugar rises rapidly and your pancreas releases large amounts of insulin. Insulin's primary job is to move that sugar from your bloodstream into your cells, where it can be used for energy. But when you are lying in bed, you are not using energy. Your muscles are not contracting. Your metabolic needs are at their absolute lowest point of the entire day. So all that sugar has nowhere productive to go. Your insulin levels stay elevated for much longer than they would during the day when you are active. And here is the cardiovascular connection that most people and even many doctors do not fully appreciate. High insulin levels directly cause your kidneys to retain sodium. When your kidneys hold on to sodium, instead of excreting it, your body retains water to maintain osmotic balance. When your body retains extra water, your total blood volume increases. And when your blood volume increases, your blood pressure goes up because your heart now has to push a larger volume of fluid through the same network of blood vessels. It is a devastating chain reaction. Late meal leads to high blood sugar, leads to high insulin, leads to sodium retention, leads to fluid retention, leads to increased blood volume, leads to elevated blood pressure, all while you are sleeping and completely oblivious to what is happening inside your body. And this cycle repeats itself every single night that you eat a heavy meal before bed. Second, let us talk about acid reflux and its hidden cardiovascular impact. When you eat a large meal, your stomach produces substantial amounts of hydrochloric acid to break down the food. When you are standing or sitting upright, gravity keeps that acid in your stomach where it belongs. But when you lie down with a full stomach, that acid can flow backward up into your esophagus. This is gastroesophageal reflux disease, and it is far more than just uncomfortable heartburn. The irritation and inflammation caused by stomach acid in your esophagus triggers complex neurological and inflammatory responses throughout your body. Acid reflux activates your vagus nerve in unpredictable and often harmful ways, which can cause heart rate irregularities and blood pressure fluctuations during sleep. It triggers the release of inflammatory cytokines, chemical messengers that circulate through your bloodstream and promote inflammation in your blood vessel walls. And chronic systemic inflammation is one of the primary drivers of atherosclerosis, the buildup of plaque in your arteries, and is directly linked to high blood pressure, heart attacks, and strokes. So acid reflux from late-night eating is not just a digestive annoyance, it is an under-recognized and underappreciated cardiovascular risk factor. Third, there is the profoundly damaging effect on sleep quality. When your body's busy digesting a large meal throughout the night, your sleep architecture gets completely disrupted. You spend less time in the deep, restorative stages of sleep, known as slow-wave sleep, which is when your body does most of its physical repair work, including repairing damaged blood vessels and cardiac tissue. You have more micro-awakenings during the night, brief moments where your brain partially wakes up, even if you do not remember it. Your REM sleep gets fragmented, your total sleep efficiency drops, and poor sleep quality is directly and independently linked to elevated blood pressure, regardless of every other risk factor. Studies involving tens of thousands of participants have consistently shown that people who sleep poorly have higher daytime and nighttime blood pressure, higher rates of hypertension, and higher rates of cardiovascular events compared to people who sleep well. So the late meal does not just spike your blood pressure directly through insulin, sodium retention, and sympathetic activation. It also spikes your blood pressure indirectly by destroying the restorative quality of your sleep. You get hit from multiple directions simultaneously. Now let me talk specifically about which types of food are the absolute worst offenders when consumed close to bedtime. High sodium foods are at the very top of the list. That leftover pizza, that bag of chips or pretzels, that frozen dinner you heated up because you got home late, that Chinese takeout or fast food you grabbed on the way home. These foods are loaded with astronomical amounts of sodium, and sodium directly raises blood pressure by forcing your body to hold on to extra fluid. Eating high sodium foods right before bed means that all that sodium is sitting in your system throughout the entire night, pulling water into your bloodstream like a sponge, expanding your blood volume, and forcing your heart to push a heavier load through your vessels for 8 straight hours. The effect on your overnight blood pressure can be dramatic. High carbohydrate and high sugar foods come next. White bread, pasta, white rice, sugary desserts, cookies, cake, ice cream, candy, and sweetened beverages. These foods cause rapid, dramatic spikes in blood sugar and insulin. And as I've already explained, that insulin surge triggers the sodium retention and fluid retention cascade that drives up your blood pressure throughout the night. The more refined and processed the carbohydrate, the faster and higher the sugar spike, and the worse the overnight blood pressure impact. High-fat foods are also significantly problematic. Fatty meals, fried foods, greasy burgers, creamy sauces, and rich desserts take the longest of all macronutrients to digest. A meal high in fat can take 6 to 8 hours or even longer to fully pass through your stomach and upper digestive tract. That means if you eat a greasy, fat-heavy meal at 9 in the evening, your body is still actively working to break it down. At 3, 4, or 5 in the morning, your metabolic rate stays elevated throughout the night. Your heart maintains an increased workload for hours. Your sympathetic nervous system stays engaged, and that healing, restorative, nocturnal dip in blood pressure never gets a chance to occur. Alcohol absolutely deserves its own detailed discussion here, because the misconception around alcohol and sleep is enormous and dangerous. Millions of people have a glass of wine, a beer, or a cocktail before bed, thinking it helps them relax and sleep better. And initially, alcohol does create a sense of relaxation. It causes a short-term drop in blood pressure as your blood vessels dilate. It makes you feel drowsy. It helps you fall asleep faster. But this is a trap. After 2 to 3 hours, as your liver metabolizes the alcohol, there is a powerful rebound effect. Your blood pressure spikes above baseline. Your heart rate increases as your body processes the toxic byproducts of alcohol metabolism. Your sleep quality absolutely plummets in the second half of the night. You wake up more frequently. You spend almost no time in deep, restorative sleep. Your stress hormones surge, and the net overall effect on your overnight blood pressure and cardiovascular health is significantly negative. That nightcap is not helping you sleep. It is not relaxing your heart. It is actively poisoning your sleep quality and driving up your blood pressure at the worst possible time. So what should you do instead? Let me give you a clear, practical, evidence-based plan that you can start implementing tonight. First, finish your last substantial meal at least 3 hours before you plan to go to sleep. If you typically go to bed at 10 o'clock, aim to finish eating by 7. This 3-hour window gives your body enough time to complete the heavy, mechanical, and metabolic work of digestion before you lie down. Your blood sugar and insulin levels have time to come back down to baseline. Your metabolic rate has time to settle. Your stomach has time to empty. Your body is ready to transition into genuine rest. Second, if you absolutely must eat something before bed because you feel genuinely, uncomfortably hungry, keep it very small and choose your foods wisely. A small handful of almonds or walnuts, a few slices of turkey breast, a small bowl of cottage cheese, a single piece of fruit like an apple or a small banana, half a cup of plain yogurt. These are foods that are low in sodium, moderate in protein, low in refined carbohydrates, and will not trigger massive insulin spikes or extended digestion. They satisfy genuine hunger without launching the cascade of cardiovascular problems I have been describing. Third, cut off alcohol entirely at least 3 to 4 hours before bed. If you enjoy a glass of wine or a beer, have it with your early dinner. Enjoy it socially, mindfully, and moderately. But do not use it as a sleep aid. It is doing the exact opposite of what you think. Fourth, dramatically reduce or completely eliminate high sodium foods in the evening hours. Save the salty snacks, the processed meals, and the takeout for earlier in the day when your body is active, upright and has time to regulate its fluid balance through physical activity and proper hydration. Fifth, elevate the head of your bed by 4 to 6 inches. If you experience any degree of acid reflux, you can use bed risers or a foam wedge pillow. Even this modest elevation can dramatically reduce the amount of stomach acid that flows back into your esophagus during the night, reducing inflammation and its downstream effects on your blood pressure and cardiovascular system. Sixth, and this is a powerful bonus strategy, take a gentle 10 to 15-minute walk after your evening meal. You do not need to power walk, you do not need to break a sweat. A slow, leisurely stroll around your neighborhood or even back and forth inside your home helps your body process blood sugar dramatically more efficiently, speeds digestion, lowers your post-meal insulin spike, and actively promotes the transition into the parasympathetic rest and restore state that your body needs to enter before sleep. This one habit alone can reduce your post-meal blood sugar spike by 20 to 30%. Let me tell you what actually happens when patients fix this one mistake. I have had patients come back to me after 4 to 6 weeks of making this single change, just moving their dinner earlier and eliminating late-night eating and alcohol, and their blood pressure numbers dropped by 10, 15, sometimes even 20 points on the systolic reading, without adding a single new medication, without changing their exercise routine, without changing what they eat, just when they eat it. Some patients were able to reduce their blood pressure medication dosage under my supervision. A few even got off medication entirely. That is the astonishing power of meal timing. Your body is not a machine that operates identically around the clock. It has rhythms, it has cycles, it has circadian patterns that dictate when certain processes should be active and when they should be dormant. It has periods designed for activity and work and periods designed for recovery and repair. And when you eat a heavy meal right before bed, you are forcing your body to do heavy metabolic work during its designated recovery period. You are overriding millions of years of evolutionary biology. And your heart, your blood vessels, your kidneys, and your brain all pay the price every single night. Here is something else critically important that I want you to understand about why this matters beyond just blood pressure numbers on a machine. When your blood pressure stays elevated overnight, it accelerates damage to every single organ in your body. Your kidneys are working overtime to filter blood at higher than normal pressure, which gradually destroys the delicate filtering units called nephrons and leads to chronic kidney disease over time. Your brain is being subjected to higher pressures in its incredibly delicate, thin-walled blood vessels, increasing your risk of stroke, small vessel disease, vascular dementia, and cognitive decline. Your eyes are affected, with elevated overnight pressure slowly damaging the tiny blood vessels in your retinas, potentially leading to vision problems and even blindness. Your heart muscle itself is being forced to work harder against elevated pressure every single night, causing the heart walls to thicken over time, a condition called left ventricular hypertrophy, which is one of the strongest independent risk factors for heart failure, arrhythmias, and sudden cardiac death. Every single night matters. Every single meal timing decision matters. The damage is cumulative. It builds quietly, invisibly, year after year, until one day it manifests as a heart attack at 3 a.m, or a stroke in your sleep, or kidney failure that seems to come out of nowhere, or a diagnosis of heart failure that blindsides you and your family. But it did not come out of nowhere. It came from thousands of nights of elevated blood pressure caused by a habit you never thought was dangerous. I do not say these things to frighten you. I say them because I care about your life, and I want you to take this information seriously. This is not a minor lifestyle tip. This is not a wellness trend or a health fad. This is a fundamental, evidence-based change that can genuinely add healthy years to your life and protect you from the number one cause of death in the world. So tonight I challenge you, finish your dinner early, have your last bite of food at least 3 hours before you plan to sleep. Drink water or herbal tea instead of alcohol in the evening. Take a gentle walk after your meal. Skip the late night snacking. And when you finally lie down, let your body do what it is magnificently designed to do. Let it rest. Let your blood pressure drop into that protective, healing dip. Let your heart slow down and recover. Let your arteries relax and repair. Let your kidneys work at a comfortable pace. Let your brain bathe in the restorative chemistry of deep, uninterrupted sleep. Your body knows exactly how to heal itself. You just have to stop getting in the way. Drop a comment below and tell me what time you normally eat your last meal of the day. I genuinely want to know. And if you realize after watching this video that you have been eating too late, that you have been sabotaging your blood pressure every single night without knowing it, type the word change in the comments as your commitment to fixing this starting tonight. I want to see that word flood the comments section. Share this video with anyone you know who struggles with high blood pressure, who takes blood pressure medication, or who frequently eats late at night. This could be the one piece of information, the one video, that finally makes a real difference in their health and potentially saves their life. Subscribe and turn on notifications, because I have so much more critical information to share with you about protecting your heart and living a longer, healthier, more energetic life. I will see you in the next video. Sleep well tonight. Your heart is counting on it.